well
now.
Yeah.
Oh yeah.
Mm-hmm.
I'm feeling like being well now. I just got adjusted.
Yeah, and you should be well now.
Feel great. Chiropractic care. It's kind of what you do. I'm Nick, the curious patient of Dr. Ron Dummar in Heber City, Utah, here at Community Health and Wellness. This is the Be Well Now podcast, and today was Family Chiropractic Day, correct?
That's right. Family Day in our clinic.
Yeah, so we figured let's talk about family wellness through chiropractic.
Yeah, what a crazy idea. Why have the whole family be well?
Is this a vessel through which, we can teach kids about being well? I don't know, because you think stereotypically of like, my back made noises when somebody cracked it, and that's chiropractic, and that's not what you think of it as. So I wanted to offer that up to you and let you say what you feel like you want to say.
Yeah, well, I mean, family wellness ultimately is the idea of communicating to the entire family in ways that the individual can understand and grasp and grapple with, right? Of how to better their lives in incremental ways. And that's really at the basis of wellness care, family chiropractic wellness care. And that's what we aim. We offer a monthly wellness day for the family to come in, and we encourage families to come in, and they do. We have families of all sorts of numbers, and we do have individuals come in on the day as well. But it's super fun. It's very lively. The children are very engaged, and we aim to teach them about their bodies and how to maintain better health. And it also is a time for parents to engage in the physicians, the doctors, to ask questions,
right,
and then potentially begin the process of caring for certain ailments or conditions that might not otherwise be considered or were not considered to be chiropractic focused.
Well, yeah, and so let's talk about what chiropractic is and how that can actually lead to a healthier life. But I'm also intrigued by the idea of getting one-on-one time with a physician and just talking about your health. Because people think about it all the time.
Oh, yeah,
How
absolutely.
am I feeling today? What can I put in my body now?
And
My
am
body
I
feels...
off?
Yeah. And then they get this time with you, and it's maybe another opportunity for them to sort of check in with you, who... Let's talk about what chiropractic is and how it's more than just cracking a back.
So on some level, what patients are looking for and need is accountability, kind of to the point that you were making as well. And having that check-in, there's a little bit of accountability of, am I being accountable to myself for my health? And children need the accountability as well. And parents need the guidance.
Children do.
Yeah. And but they need the guidance. Parents need guidance as well as to how to help the children be accountable. Yes, because first thing for children to begin to recognize is how things actually affect them. Food that they put into their mouth is going to affect them. Things that they call food, which isn't food that they put into their mouth, will affect them. And they need to begin to learn how to make proper selection of food choices and what things are going to be doing in their bodies when they select them. Okay? And parents are there all the time. They're the ultimate guardian. Well, they're the best guardian, the most frequent guardian of what that child is being fed and what their nutrition is like. But chiropractic at large is a profession. It's a healthcare profession that focuses on whole person health. It's not just spine. It's not just nervous system. It's not just muscles. It's whole person health. Brain, neurology, internal organs, internal medicine, nutrition, radiology, orthopedics, pediatrics, gynecology. Each of these are actually specialties within chiropractic medicine. So you could go to and find a physician who specializes within chiropractic medicine, nutrition. Now, all chiropractors, and this is, I think, a very, very good thing about the chiropractic profession at large right now, is that all of them come out with a very incredible understanding of neurology, physiology, the biomechanics, and how to treat a significant amount of ailments, especially as it pertains to orthopedics and physical medicine. So all chiropractors come out equipped from school immediately with that. these specialties that I'm talking about are actually above and beyond. Sports medicine residencies or residents we have as well. But all of these, from pediatrics to nutrition and even gynecology, right, are covered in the chiropractic profession. So it's really looking at whole person health. So from each of those specialties, the chiropractic physician is going to want to administer health to the individual in the minimally invasive way possible, meaning the least invasive way possible.
So chiropractic is about minimally invasive healthcare?
Absolutely.
And what's the deal with the spine?
For a whole person health.
And getting me adjusted? Is that something that every chiropractor learns out of school and then that's like the foundation? Or
so the foundation of chiropractic, the foundation of it, and the basis of, you could say, of chiropractic is the brain, right, that connects to the spinal cord and the nerves that initiates the functions for all of our activities, for our organs, for our contraction of our muscles, for the beating of our heart, right? So we focus on brain and neurology, and then we focus on the spine that encompasses and the skeletal system that encompasses that neurology and protects it. So you could have a protective mechanism that is a restriction to some point in the spine that's reducing the amount of motion that spine is generating for the person. And that may result in a postural deformity or an abnormal posture of some sort. That could be more genetic, or it could be a birth-related issue. Or what happens more commonly with people is that they have certain dysfunctions that occur that result in aches or pains in their body. And frequently they just blow it off, or they go and rest, and they wait until they don't feel it anymore. And essentially what they're doing in that case is adapting. They're just adapting to that dysfunction that they incurred. And once they adapt to it, it starts this chain up through the spine. You know, it's like a slinky, you could say. You pull on one, bloop, it's going to pull a little bit more. You pull more on that one, it's going to pull more. You pull more, right? And it's going to affect everywhere along that chain, which is your spine, the joints along your spine. So the spinal cord is protected by the spine itself, the vertebra. And those vertebral bodies are strong and firm and hard, because if you damage your spinal cord, if you damage that neurology, we have significant problems, right? We could have limb issues. We could have weakness. We could even have a complete and total loss of the use of our limbs from damaging that neurology, okay? So it is critical, the function that the skeletal system plays in the protection of neurology. So now what happens if that skeletal system becomes somewhat dysfunctional in its action? Meaning if I have a joint and it's moving adequately, well, that's great. I can bend, I can turn, I can twist. But what happens when I have a joint that is for some reason not moving like it should? Well, it's going to restrict my ability to move, and it's going to lead to likely greater strain on other areas that then have to compensate for it. And that can lead to, well, degeneration. It can lead to sprains and strains. And so what we're aiming to do ultimately is say, okay, we want to improve the function overall of the spine. Now you can imagine, if we improve the function of the spine, what are we also improving?
The brain.
We're improving the brain.
See, I didn't realize that the brain nutrition, because I feel like I learned this a while ago on YouTube University.
Yeah, there you go.
A lot of life is like brain chemistry. Like it's the brain.
Exactly.
That's the ball game.
Mm-hmm.
And so when I hear you tell me that improved spinal health helps everything get to the brain and have everything flow better, or whatever it is that you want to tell me, in the right language, that's where I kind of perked up and I was like, oh yeah, it's not just like these discs in my spine. There's like an actual spinal cord in there.
Yes.
People get paralyzed when their spinal cord gets damaged. So that thing really matters. And then that connects to my brain. Like, oh yeah, the spine, that's a big deal.
Mm-hmm.
I don't know why it hadn't connected like that.
Yeah. So imagine that you have a slinky again, right? And that you open the slinky and each of the segments moves equally. And you close the slinky and it moves equally. right? And it's like, oh, that's functioning really well. Well, now imagine you take one segment of that slinky and you squeeze it together. Well, so that segment, which is the spine, that segment of the spine is no longer functioning or moving as well as it should for whatever reason. It could be a local inflammatory response. Could be that there was damage to the tissue in that region. Could be a fall. There's a lot of things that can happen, right? But for whatever reason, there's inflammation and it's caused a shutdown in the motion of that portion of the slinky. Now you go to expand that slinky. What happens to that segment?
I don't know.
Well, there's a lot more stress on it, right? And what happens to every other segment? Well, in our brain, we're used to like reaching a certain amount, right? We're used to being able to move our spine to a certain amount or bend or twist. And so we're going to try to go to that point. And that's going to require a lot more adapting by every other segment of the slinky. So now every other segment is working harder to compensate for the dysfunction of the one. Okay? Now, that can lead to continual dysfunction up the chain, right? And you can imagine, well, this is essentially the process of arthritis and stiffening up and tightening up and restricting of the movement of the spine, because as it moves up the segments, it begins to restrict the function and movement of the spine at large. And it does it one by one, simple, little by little.
So when you're adjusting somebody, what are you doing?
So what I'm looking for is I'm looking to isolate that spot where the slinky is pinched, right? That segment that is the most restricted segment of the patient, and to free that segment so that it releases the strain from the whole rest of the slinky, right? So now it doesn't have to, the rest of the slinky is not having to compensate for the lack of motion of that one segment. It's able to open up freely and close all together as a whole unit.
And chiropractic can reduce pain. It can improve function and maximize performance, improve neurology. You talk about reduce strain to brainstem and reduce onset of arthritis and degeneration. Like, what's happening there?
So you have natural curvatures in your spine, okay? You have natural curvatures in your spine. In your neck, it actually curves forward towards your Adam's apple. Okay? Your spine will curve forward. If you have a reverse curvature or a straightened curve, which means you've lost the curve, this can happen again from a fall where the muscles spasm and tighten up the neck and try to protect it, but there's no real care initiated for the patient to try to reestablish and encourage that natural curvature. And so, but what that can initiate is a rise or a stretching of the spinal cord by up to 5 to 7 centimeters. So just having this change in the curvature, imagine that your spinal cord moves through your spine just like that in a kind of in a circular C type shape. And you go to flatten that and straighten it out. It's going to rise and put strain now on your nerves, because it traveling through in that curvature is actually less. It allows it to be shorter than if it was fully straightened. Okay? So once you straighten that curve out, now you're stretching and straining the nerves and the spinal cord itself, which then leads to dysfunction to the neurons and the axons that have to power the muscular contractions all the way down below the neck, right? And also the organs that are innervated by those nerves. So everything below there, that tension, it's going to cause dysfunction and strain. So eventually you will develop some sort of disease or some sort of dysfunction, whether it be musculoskeletal or organic, as a result of aberrant transmission of neurology from the brain.
Aberrant transmission of neurology. I have no idea what that means.
Poor transmission of nerves.
I kind of did, but I'm just trying to help you
say things differently.
Because it sounds so advanced, and I'm getting it, but I'm calling you out just because I
hear
your big words.
Oh, yeah. Well, and I'm plugging these in, intentionally.
Yes, to sound smart.
Someone's got to sound smart, right?
Well, you said enervate, which ENERVATE.
Innervate, yeah.
Oh, is that enervate? Is that to make less? Is that reduction in energy?
So innervation is essentially the activation of an end organ or an end muscle. So it's innervation is the description to say that a nerve plugs into this. It innervates that.
Oh, okay.
Okay. So it causes the action.
Okay. Wow. I'm going to listen to this again and try to process everything you just said. So you're trying to send a message to your kids as well that health is super important, right? Like you're communicating that to your children. How does bringing them in and helping them get chiropractic kind of reinforce some of that messaging, or how does that start things?
Yeah, so kids love to run and jump and play. I had a kid just today. He got it, well, a few of them. There were 3 in one family, and 3 boys actually, and one had recently been in a cycling bicycle accident, and he had road rash on his arm, and he had slammed his jaw, and so we worked on his jaw. We worked on the muscles and their medial lateral pterygoid muscles to help reset that and make sure it was aligned properly. We worked on his elbow, his extremities, right, so that he could basically do what he loves to do and hopefully do it more safely. But yeah, when kids have these falls, it's not like they don't get injured. People often look at kids and they say, oh, they're so resilient, they bounce back. And yeah, it looks like that. They have the appearance of that because they have they tend to be more pliable, more flexible, and they adapt because they a lot of their bones haven't even fused entirely yet. So it appears as though they adapt so much better. But that doesn't mean they don't have the injury. It just means or the joint restriction. It just means that they've adapted to it, and it doesn't seem to bother them as much. Okay, so we need to identify: did you have a fall? Some often happens on trampolines or off of bikes. Another one of the kids, it was a scooter crash, right? And so we're checking them. We're checking their necks because when you have these falls, your head's whipping around most of the time. Well, what is that going to do? It's going to cause dysfunction or cause irritation or strain to the muscles of the neck, and possibly even cause dysfunction, which often it does, to the joints of the spine, in the cervical spine, which is the neck. So it's critical for us to make sure that those joints are moving adequately, because 90% of the nutrition to your brain actually comes from adequate and optimal motion of the spine. So if you want, good nutrients flowing to your brain on a regular basis, then you'll make sure that you have good and adequate spinal motion. So this is critical. And I tell my kids to, my young athletes that come in, it's like, this is going to help you actually be faster. It's going to help you utilize and harness the musculoskeletal system more optimally.
And so you have these conversations with them. You're not just adjusting them and not explaining it.
Right. It's not just about like, just pop and click. It's about, okay, what is this doing for you? Well, if it's helping the brain and neurology as well, if it's helping to balance the autonomic nervous system, which it does do, then it's also helping to optimize immunity, like your immune system, the way your immune system functions. Chiropractors for ages have treated with chiropractic and nutrition, but treated otitis media, which essentially is ear infections, right? They've treated sinusitis and all sorts of related upper respiratory and even lung conditions. If you want to have proper expelling of a bacterial infection or a viral infection from the lung, well, you want to make sure you have full expansion of the rib cage. And if you have a spinal dysfunction or a joint that's not functioning properly, which the ribs come around and they have joint segments that interact or have a junction, a point of interaction with the spine. if you want that to be functioning properly and optimally to open up the lungs, well, you need to make sure that those segments are not restricted. They all need to be, again, functioning as well as possible. And then that way you can actually get a deep breath. And then when you're expelling the bacteria or the virus and clearing that from the lungs, you're getting all the way down to the lower lungs.
So it's a good idea to get adjusted when you're sick.
Absolutely. Absolutely. It's a very good thing for the health of the patient in general, the neurology, the nutrition, throughout your entire body, not just to your brain, but to your entire body. The nutrition and the blood flow is going to be improved. In fact, there are deviations in posture, right? A study was done and it determined that deviations in posture of patients led to constipation, varicose veins. It led to essentially lower or higher mortality rates, right? Meaning people don't live as long if their posture is not adequate. Well, your posture is dependent on how well your spine functions and moves. And that's a chiropractor's role. That's ultimately, again, the basis of his education is in the spine, the nerves, and the muscles. And beyond that, obviously, I've specialized in internal medicine and pediatrics. And so I do a lot with all of the other areas and nutrition. And so it all has to be all-encompassing. It's not just one piece of it. And that's why we say chiropractic also is a profession that addresses the whole. As a practitioner, we attempt to address the whole. But we realize as well that there are other specialties that are required that may need to be brought in, whether that's mental health specialties or otherwise. We will reach out for that help and benefit when needed.
And then you recommend chiropractic care for kids. I know it can be a little scary for parents who may be on the fence about chiropractic. Like, you're going to do that to my kid?
Yeah. So my nephew was in here the other day, and he's been married for a little while, and he said he came in because he had some back pain that he had gotten while he was doing some paddle boarding and was trying to lift up this paddle board. And apparently it was really heavy, and there had gotten water seeped into it somehow. And so he was trying to move it, and then he felt this twinge in his back, and he'd gone on for a while.
Never think it's going to happen to you until it does. So
right?
Before
exactly.
I think, oh, what an idiot for doing that. It's like, no, we're all one thing away. It's happened to all of us, right?
Yeah, it happens. So anyway, we treated him and took care of him, and he responded really well to the care. And he had told me that his wife they had just been on a trip, and basically they learned just as they were going or just after they arrived on the trip that she was pregnant. So congratulations. And I told him about what we can do. I was like, we can help her a lot with acupuncture, with chiropractic, neurology, to help with morning sickness. And then also, then I started to mention to him, he's like, wait, you can do chiropractic for pregnancy? I was like, oh, we do it all the time. We treat the pregnant spine, and it's so beneficial. If you ask a pregnant patient of ours who's receiving care, it is so beneficial for them. Again, we're improving the neurology and the nutrition to areas of the body that are receiving a lot of attention, right? And we're working on ligaments and muscles that are in they're in a point of great expanding right now, right? And adjustment. There's a lot of changing that's happening. And so as those adjustments and changes are happening in the body, we want to make that as comfortable as possible for the patient. So we treat patients all the way through pregnancy. We actually have a specific pregnancy plan that we have them follow. But then, in addition, when the baby is delivered, as soon as the mother and father or care providers are ready, we treat the infant. And this is something that a lot of people, again, like you said, and my nephew asked the same thing. Wait a minute, does that make you nervous to like rack and crack or like push on an infant like that? I was like, well, it doesn't happen that way, right? We don't address the infant's spine like a like we're taking on a sumo wrestling event or something. That's not how it works at all. It's very gentle, as most of chiropractic is very gentle. But there's certain aspects of it where you feel like, whoa, that required some force. Okay, but that's not for the infant. That's for more of the adult spine. The pediatric spine and the infant spine we're working with in very gentle ways to optimize, again, motion and reduce the dysfunction or the lack of motion. Now, imagine the birth process. Like, imagine yourself for just a moment needing to squeeze through. There was this set of caves that we used to go splunking at when we were kids, and there was this one segment of it called the birth canal. It was called the birth canal because it kept narrowing and narrowing and narrowing, and then if you could actually get to the point where you could squeeze through it, it would open up. But first of all, it was somewhat terrifying.
Yeah, it sounds horrible.
Yeah.
I don't want to go on that.
You know, you're under the ground, deep in a hole, and then you're trying to squeeze through there and feeling like you're going to get stuck at any moment, which essentially is what it is. But the idea is birth is traumatic for an infant. It's even if you have a C-section, sometimes a C-section is more traumatic for the infant on their cervical spine and their skull. And so sometimes people will have what they call shoulder dystocia, where they can't get through because the shoulder essentially has formed prematurely, or the clavicle, and it ends up breaking, or they need to break it to get the infant out, right? Birth is traumatic. Let's just be honest with that. And it's a significant event. However, it's also something that we participate in and have participated in for thousands of years. So it can be supported through optimization of the musculoskeletal system. So how do we do that? Well, first of all, we want to make sure as the relaxin comes out into the body and the pelvis and the ilium are expanding and opening to try to deliver and allow this baby to present and sink down deep into the pelvic floor, we want to make sure there's enough room and alignment for that infant to move through, the fetus to move through. And you can imagine if you have a pelvis sitting like this, lined up where the fingers, you could see my hand, my fingers are lined up there, the pubic bone's lined up, and you shift that spine slightly. You see that opening right here. See how that changes, even just moving it slightly. And you can see how that narrows that opening to where someone might have a more difficult time with baby making it into this world if that dysfunction is not corrected. So that's one area that we work to correct. The other areas are the ligaments of that connect to the uterus, the anterior abdominal wall and also the posterior sacral wall. And then they attach to the uterus. Okay, so that's the uterosacral ligament and the round ligament anteriorly. So we work on those ligaments to help open the uterus and allow it to be balanced, so that the space that is provided for the fetus is as great as possible, so that the fetus can present in whatever way it chooses. So that was maybe a deviation from exactly where we're going, but it does demonstrate, I think, that we can work on pregnancy, infants. We help to improve and reduce the labor time. Chiropractic care has been shown to reduce labor time by 30%.
That's wild.
So if you get chiropractic care throughout your pregnancy, you can look forward to likely a more smooth pregnancy and birth.
So whether you have a family or you're a family to be,
chiropractic care.
Chiropractic care for the win. I learned a lot, man. I love the idea that it can improve so many things in your health. I thought my back was just getting cracked, and that was probably good for me, but we've learned a lot here. We just scratched the surface, I feel like, on this episode of Be Well Now. Namaste.
Namaste.